Oi, punters, you want to hear a joke? Yeah, you ready? Private healthcare. No, what do you mean it doesn't have a punchline? Like, we're the punchline because we're the ones paying for it. It's not very funny, is it? Oh, are you subbed to the channel? Yeah, if you could just hit the sub button and the bell. And then they're like, yeah, cheers, punt. Now, do you have private healthcare? Well, believe it or not, I have actual literal footage of me purchasing private healthcare. Here's how it went. Let's take a look. You need private health insurance.
Yeah, I'm good, thanks.
How about we cover 30% of your private health insurance?
Yeah, still don't want it. I'm good with Medicare, yeah?
Just buy the insurance.
Are you forcing me to buy his product that I don't want?
No, it's completely your choice, but if you don't make the right choice, I'm gonna put up your taxes.
So you are forcing me?
Of course you've got choice. You can either give your money to him or to me.
How much are you subsidizing him?
Just 7.5 billion?
A year?
Could be more than that.
Free dental for all Aussies in Australia would only cost 7.7 billion.
Ooh, we couldn't afford that. Can't waste taxpayer money like that.
You just gave him 7.5.
Oh, well, he helps take the burden off the public system. Yeah.
No, it doesn't. I think it makes it worse. And disadvantages poor people.
And just pay him, will you?
How about no?
Listen, if you don't give him money right now, if you want private healthcare in the future, I'll make you pay 70% more than everybody else.
Are you threatening me?
It's for your own good.
Okay, fine. Yep, just take your money.
Maybe I can get that surgery I've been waiting for.
Ooh, shoulder was it?
Yeah, we don't cover that. Sorry. Now, if you've turned 30, you will have been through exactly this rigmarole. You suddenly turn 30, you think, hang on, don't we have universal healthcare here in Australia? And the answer is yes, but the government wants to do everything it bloody can to get you off the universal healthcare and onto some private cartels BS private health insurance. And it's at this moment you realize that Australia's healthcare isn't as good as, I don't know, I thought it was when I was younger. You know, we look at America and we look at their healthcare system and we're like, you guys are a bunch of absolute idiots. You pay the highest prices in the world for the worst possible health outcomes. 50% of all bankruptcies or something are healthcare related. And in Australia, we go, how smart and lucky are we that we're not as dumb as them? Because we have universal healthcare. We've decided that, you know what, we all pool our money into a national insurance scheme and then we can all pay out the money to whoever needs it. Every major developed country has worked this out, and Australia is one of them. So quick props to Australia, well done. Except this scheme is hated by most governments that we've had, and most governments are doing everything they can to undermine and wreck our universal healthcare system to siphon more money to their corporate bludgeoning mates. And this is exactly how they do it. Let's just jump back in history just a little bit. In the late 1990s, after 15 years or so of Medicare, fewer than a third of Australians held private health insurance. Now, Johnny Howard was not a fan of this system. Johnny Howard, your mum's favourite prime minister, he once called it one of the great failures of the Hawke government. So classic conservative politician there. And he set about to destroy it piece by piece. But it's hard to destroy something that Aussies bloody love, which is not going bankrupt when you get sick and not dying because you can't afford care. He began by introducing a surcharge to penalise high-income earners who did not have private health insurance. And here's a little graph here. We can see how it introduced a few little things. So the first thing was a bit of a stick to just whack people. You don't have private health insurance? I will charge you more unless you give that company money. That was the first thing he did. But guess what? Aussies, we were like, all right, fine. I guess we'll pay a little bit more because healthcare's pretty good, and I'm, I'll cop the hit. And it didn't really budge, so he introduced it there and no one was getting on it. So then he went, all right, let's sweeten this with a carrot. That's when he provided a rebate on your private health insurance. That's what I was talking about in the video. The rebate is here. There's different rates, and the government will pay up to 30% of your private health insurance. So our tax dollars that we all give to the government, they are using your tax dollars to help other people give their money to private health insurers. So when you buy private health insurance, you get a discount of up to 30% thanks to we Aussie taxpayers. And how much does that add up to? Well, This year, it's added up to about 7.5 billion. But then I found another citation here that says from the Govt Institute saying about 6 billion for private health rebate and then 3 billion extra on private medical services. So let's call it between 7.5 billion and 9 billion to subsidize private health insurance. And that resulted in a bit of an uptake. So everyone liked the carrot. They go, okay, if you're going to discount this product that I don't want, I guess maybe I'll get it since I've got to pay a tax for it anyway. And then he did one last lucky thing, and it was the biggest stick of all. It really just whacks you over the head and tries to fill you with fear to, once again, buy this product that you don't want. And that was this one here, the lifetime health cover loading. You will pay up to 2% of your LCH loading on top of your premium every year after you're 30 if you do not have private health insurance. So I'm 35. Full disclosure, I do not have private health insurance. So because I procrastinated 5 years, that's 2% every 5 years. If I got private health insurance next year, it'd be 2, 4, 6, 8, 10% higher than some other punter that bought private health insurance. So this is some great super free market thinking by Johnny Howard here. He's saying, I'm going to be so free market that here's a health insurance product that nobody wants. I am going to tax you more if you don't buy it. I'm going to discount it you with taxpayer money to help you buy it. And then I will penalize you in the future if you don't buy it. And if you don't get health insurance, you can eventually pay up to 70% more if you do not decide to get private health insurance. So, wait, this video is brought to you by Punters Politics. That's me. If you like the show, enjoy the channel, you can head to punterspolitics.com, pick yourself up a super cool looking t-shirt like this one. Anyway, shut up, Conrad. Back to the video. This is corporate welfare at its finest. Corporations using the government to force people to buy a product. Now, $9 billion, that ain't nothing, but these big numbers, they often mean nothing. So let me try and put it into perspective here like I did in the video. Different numbers floating around with universal dental scheme. This is in 2019, 5.6 billion. I've seen it cited up to 7.5 billion, 8 billion. Hell, let's call it $9 billion. So an extra $2 billion. We could all get free necessary dental with Medicare, or we could give $9 billion to health insurance companies. Okay. So at this point here, the question becomes, why the bloody hell is the government going to so much trouble to give this much money to private health insurance corporations? They'll tell us three things. Number one, they tell us that it takes the pressure off the public healthcare system. Number two, they tell us that the private sector is just more efficient and better run. And number three, they'll tell us that you'll get better care. It'll be better if you just get off the private healthcare system. So let's go through this one by one. Number one, does it take the burden off the public healthcare system? Let's take a quick look at some metrics. What would it look like to take the burden off the healthcare system? Well, it'll probably look like shortening wait times, like elective surgeries often take a year, maybe 2 if you're really unlucky. Well, let's have a look. Does private health insurance cut public hospital waiting lists? We found it barely makes a dent. Okay. Our analysis suggests that if an extra 65,000 people buy private health insurance, public hospital waiting lists barely shift from an average of 69 days. Waiting lists are shortened by 8 hours. Okay, $7 billion for an 8-hour saving? Oh, maybe. This is not the only place I found this. Here's another bloke I found here. Dr. Henry Cutler, director of Macquarie University, Centre for Health Economy, said there is no empirical evidence that says increased private healthcare membership leads to lower public hospital waiting times. In fact, research suggests that increased memberships from the late 1990s reforms did nothing to wait time. So we've got 8 hours and we've got nothing. Okay, we're not off to a great start here. But it's even worse than this. Not only does it potentially do nothing, having parallel private healthcare system, which is what we have today, public alongside private, saps resources from the public system and, contrary to the arguments of advocates, does not reduce waiting times for those in public sector, so private payments is more likely to do harm to the public system than good. So the government is spending $9 billion to do harm to the public system. Cool. And not only does it create inequality, but it may also be inefficient. So this leads us to the second point, that the private hospital system is more efficient. According to the Govt Institute here, multi-payer systems consume greater share of gross domestic product than healthcare in single-payer systems. So more resources are going to administer the same amount, if not less, healthcare products. And then from Greg Jericho here, it says that the public system admin costs are much lower. Okay, so doesn't reduce wait times, looking like it's a more inefficient system to run. So at least does it provide better quality of care? Apparently, there is no Australian evidence of association between out-of-pocket payments and quality. The limited US evidence suggests that an inverse relation between provider and quality. So there's not much evidence to show that if you start paying more for it through these private providers that you actually get better care. Now, just to be very fair with what I found, that I wasn't just cherry picking the stuff that suited my bloody narrative here, I did find this article here that says people with private health insurance save the government $550 a year on average. So I just need to go to someone more qualified to be able to explain to me how you get potentially a saving of $550 per year on anyone with private health insurance, and Greg Jericho and the Grattan Institute assertion that overall it's unlikely that taxpayer subsidies on private health insurance reduce the total spending on health. So they're probably looking at slightly different metrics, and you can kind of cherry pick the data that suits your narrative. So you could, feel free to cherry pick from what I've provided here. Also, fact checks welcome, citations necessary in the comments below. Okay, so let's come to the next section of this video. If the current system we have now sucks and hurts the public healthcare system, who is currently benefiting from the system that we have right now? Because we wouldn't have it if some bloody corporates weren't making billions off it. So the system right now, who does it benefit? Who does it harm? So the government giving all these private health insurance rebates says, this and other research points to these rebates largely going to people on higher incomes who are more likely to buy private health insurance anyway. So this means rebates for older people and wealthy people. So if you're older and wealthy and you want to get private health insurance, this is a great system for you because the taxpayer is subsidizing you for a product that you are likely going to buy anyway. But honestly, let's not blame old and rich people. Let's blame the real bloody bludgers here, and that is the Australian health insurers. These are the corporate welfare queens, the dole bludgers of Australia, more corporate dole bludgers. Take a look at this. Australian health insurers earned $1.3 billion more in surplus in the last 2 years. Now, I had to look this up. Surplus is not to be confused with profit. Surplus is the difference between how much money they took in on premiums and how much money they paid out on claims. Ultimately, it means they return less money to customers. That doesn't sound good. But let's get to profit. Net profit after tax increased 110%. With $2.19 billion in net profit in 2022 and 2023, up $1 billion. So this system's working real well for those shareholders of these healthcare corps and those CEOs. So while profits were increasing, they found that the proportion of hospital insurance policy premiums returned to patients and rebates were decreasing. Okay, so while profits are going up, rebates are going down. But yes, that's the business model of these corporations, to delay, deny, and litigate, to not pay out the claims that they ought to pay out, because when they don't pay it out, their profits go up. Net profit at Medibank jumped almost 30%. So let me summarize. We've got a corporation that has a product that most Aussies don't want or need. And then we've got a government forcing we punters to buy this product that we don't want or need. That when we do buy it, it makes our universal healthcare system worse. It saps resources from the public system and benefits older, wealthier people whilst delivering mega profit. Right, so I'm just working out, is that how the free market works? You know, you make a product that no one wants and then use the government to force everyone to buy that product, and then you make billions of dollars. Is that capitalism 101, or is that, oh no, that's crony capitalism. I remember now. Let's just let Greg Jericho here wrap it up as he says, we have a system that attempts to force young people to take out private health insurance policy that they don't want or particularly need in order to fund the use of it by old people. Cool. Ultimately transferring funds from young to old. We have a public-private healthcare mix, but over the last 40 years, people have shown through their spending choices that they prefer the public system. And yet, the government prefers to pick a winner and prop up a private sector. And as ever, the private system has taken advantage. Boy, have they taken advantage. How about those $2.19 billion in profits? Not through being a good business, not through selling a product people want, but through using the government to make big bank. And that is how corporate dole bludgers do it, punters. So by no means is this a video telling you whether or not you should buy private health insurance. I don't know. I'm just letting you know how these corporate dole bludgers continue to manipulate our government to make absolute bank off your tax dollars. So massive thanks to we the punters over on Patreon. These are the punters that keep me making the videos that I think are important, like this one, and not just the videos that get the clicks. So if you enjoyed the video, feel free to share it with a punter who might not know just how scammed we're getting. And if you really liked it, you can head to punterspolitics.com, pick yourself up a Punters Politics t-shirt, keep me doing what I'm doing, give the video a like, the channel a sub, and I'll catch you punts in the next video. Cheers, punts.